Hi everyone, this is Dr. Frank Castiglione, and we're coming to you from Castiglione Chiropractic Centers, and this is for your total body health. Today we have Frank, and we're doing a follow-up visit. It's been a week later after his ankle sprain, and he's only had 3 treatments. And we're going to show you that after his rehab, he's had 3 treatments of ultrasound and muscle stim. And this is the ankle that you saw about a week earlier. That was all black and blue. We still have some swelling, and we're going to do some ultrasound and muscle stim to get the swelling down, but the black and blueness is gone. And he's actually been working on it already, which normally someone would have been off for probably a week or 2 with the type of sprain that he had. So we're going to go ahead and do some ultrasound on it. This is going to get the swelling down, increase blood flow, decrease the swelling, and we're also going to adjust his ankle after we do this. After we get the swelling down, I'm going to check the alignment of his ankle and make sure it's all in its proper alignment and the joints are in their proper position. So if you remember on the last video, you can check the last video. It was all black and blue, and we were literally, as we were doing ultrasound last time, the black and blueness was just clearing up as we were doing it. So this is definitely one of the therapies of choice if you have a sprained ankle. You want to get ultrasound, muscle stim, and then actually get the ankle adjusted. So this is Dr. Frank. We're coming to you from Castiglione Chiropractic Centers, and this is for your total body health. Okay, we just finished doing the ultrasound, and I'm going to wipe this off in a minute. But this is the ultrasound machine, and then this is the electronic muscle stim machine. We have 4 different types of therapy here: the interferential, biphasic, Russian stim, and then another one here. And we can also do 4 different frequencies of these 2 types of therapy. So there's about 8 different therapies just in this machine alone for muscle stim. We can also tie this machine into here and run current through the ultrasound and do ultrasound and muscle stim at the same time. Well, in Frank's case, what we're doing today is we're going to do muscle stim separately and ultrasound separately, and we're going to go ahead and hook him up to the muscle stim right now. And so what I'm doing is I'm putting a red positive pad right here, and we're going to actually run the current diagonally through his ankle. I'm going to be on the same circuit here. This one's going to go over here on this side. So that current's going to go from here to here, and we're doing low volt alternating current, which is not painful, right, Frank?
Nope.
And actually feels good. And then this one we're going to run current this way diagonally through to the other side. And this is going to get rid of swelling, increase the healing of the ligaments that have been injured in the ankle, decrease the swelling, increase blood flow, and also kind of relax his ankles so that when I go to adjust him, his ankle moves nice and easy. Okay, so that's about it. Hi everyone, this is Dr. Castiglione coming to you from Castiglione Chiropractic Centers, and this is for your total body health. Today we're here with Frank, and we're working on his ankle. He sprained it pretty severely a week ago, and he came in the same day because he's an existing patient. He knows what it can do for ankles, and had he waited more than that one day, it would have taken him a week to be able to actually put weight on it if he didn't get his ankle adjusted. So we did muscle stim, ultrasound, and we adjusted the ankle, and he was actually able to go back to work the next day. And had he waited 2 days, it would have taken 2 weeks of him being off the ankle. So here's Frank. I'm going to just ask him a couple questions. And how you doing, Frank?
I'm doing great.
Good. And how'd you feel after the first treatment, or how did you feel initially without any treatment at all?
Well, initially I was in a lot of pain. That's why I contacted you early in the morning, and I was glad that you were able to get me in early in the morning. So I was in a lot of pain. I really couldn't walk.
How did you do it?
Well, actually, I was walking out to the street, and I didn't realize that there was was a pretty good sized rock there, and I actually stepped on it and just rolled my ankle. And the amount of pain that I felt at that, actually I thought I broke my ankle, to be honest with you. So I was out there for a good 3 or 4 minutes just kind of hobbling over there. And then I contacted Dr. Frank. So there was a lot of pain,
Yeah. And so he came in initially, and you could see the before and after on video, how swollen it was in black and blue. And then I adjusted the ankle, put it back in alignment, which we're going to show you in a few minutes after his therapy is done. And he's doing good. So this is Dr. Castiglione. We're coming to you from Castiglione Chiropractic Centers. This is for your total body health. All right, so what we're doing is we're checking his ankle. We just got done finished with the ultrasound and muscle stim. And I'm going to mobilize his ankle. We're going to check and make sure which joints are out of alignment, if there's any at all. And if there is, I'm going to adjust it and realign and reduce the subluxation, which is the joints being out of place in the ankle, which they have been, and I haven't seen him in a few days. So he might be in alignment, he might not be. So we're checking the talus and the calcaneal joint right now. And now we're going to check the talus joint and the tibiofibular joint for motion. Everything feels like it's moving pretty good right now. How does it feel to you, Frank?
It's tender.
It's tender? Is it sort of going this way?
No,
How about this way?
very little.
About like that?
Yeah, a little bit right there. Yeah.
Where does that hurt? Let me do that.
Right on there, on top there.
Okay. So that's called the anterior drawer test. How about that?
Nope.
No pain doing that. So he's got a positive anterior drawer test. All the other ones were negative, which are all orthopedic exam tests. So I'm going to adjust his ankle. Feels like it's out a little bit right here. Okay, just relax, Frankie. One more time. Right. Get the heel this time a little bit. Just relax your leg. There we go. So it was just a little bit out of alignment, and our cameraman is just busting up right now. Really thought that was pretty funny. All right, so this is Dr. Frank. We're coming to you from Castiglione Chiropractic Centers. This is for your total body health.